Well, because I was just under 40 when I was diagnosed, the hospital suggested I have genetic testing done, which I did, and they found that I was BRCA breast cancer 1 gene positive, which was really, for me, it was really I found it really quite stressful because, I mean, it was, at least I have kids, and we weren't planning any more kids anyway, but both my sisters were both still single, and so I then had to tell them that maybe they had the gene too, and that would obviously have some fairly significant implications for them. So then Mum and Dad both had the testing, and then at the same time Jennifer and Jane, and I think my brothers had the testing too, I can't quite remember now. They weren't really, I sort of pushed them into it, I think from memory they weren't really fussed about it. But certainly Jennifer and Jane had testing, and Mum and Dad, and fortunately everyone came back negative, so that was a great relief. Alex and Ben will need to have genetic testing done too, but they can't have that done till they're 18 because they need to consent to it themselves. But you know, I think we'd be strongly recommending they do, just so that if they are positive, they can be more, you know, they can just be more vigilant about making sure that they find out what their increased risks are, and if they then go on to have, or particularly daughters, what their increased risks are. So I think it's important. I think that we've been lucky that we, you know that I'm BRCA positive, so that we can do those things, or they can do those things.
There is history of cancer in my family. My father died when he was 46 of colon cancer, and I've had grandparents and a cousin who have had cancer young. So I should have myself tested for genes, especially if I want to have children in the future. It's something I can't really cope with at the moment. I have enough to deal with seeing the doctors every few months, so I will get it done, but just not yet. For me now to go on and have gene testing, and I'm just not really ready for it. But I will. I suppose it would give me answers to questions that I've had over the few years.
At a very simple level, cancer is a gene going wrong. The gynecological cancers where hereditary factors may play a role are predominantly ovarian cancer, but also endometrial cancer to some degree. It is not hereditary issues are not a problem for cervical cancer or vulval cancer. Ovarian cancer is the one that's most likely to have a hereditary component, and there is estimates that up to about 15% of ovarian cancers could have a hereditary genetic transposition. So when we're looking at ovarian cancers, the most common hereditary syndromes are BRCA1 and BRCA2, and something called Lynch syndrome, but that is less common. The majority of ovarian cancers are what we would term sporadic, and they just happen and we're not sure why they happen. We would consider referring a woman to a genetic specialist if she is under 60 when she is diagnosed with an aggressive ovarian cancer, so that she can have further testing to determine whether she does carry a BRCA mutation. To determine whether somebody has a high risk of having Lynch syndrome, we would look at their family history and be expecting to see some diagnosis of colon cancer or endometrial cancer, particularly at a young age and in several family members. There are also tests that the pathologist will do that will show up that this cancer may be linked to Lynch. Again, these women, where we are hearing these stories, would be referred to a genetic specialist for further investigations. We are not able, until a woman has seen a genetic specialist and had further testing, to be able to confirm that whether they have one of these mutations or not. When a woman has been told that she has a BRCA mutation, then her family members can be referred onto the genetic services as well for predictive testing. Although, because we talk about breast ovarian cancer, people often think that it's only female family members, we also have to be aware that it can affect her sons and her brothers as well. In BRCA2, for example, there are other associations with pancreatic cancer, prostate cancer and male breast cancer. If family members may choose or choose not to have predictive testing, but those who do choose to have predictive testing will find out whether they are at increased risk of developing a cancer or whether they are just population risk if they don't carry the mutation. For those who are at increased risk, it doesn't definitely mean that they will develop that cancer. Often a woman may be perceived to be at high risk of having a hereditary cancer syndrome, but it's just that the gene has not been identified. And that can be because looking for a gene is a bit like looking through a book to try and find the typo. Just because you don't find it doesn't mean it isn't there. In those women, we will often determine them as we call high risk. And although their families cannot be then tested for predictive testing because we haven't identified the gene, their families may still want to treat themselves as if they are carrying a mutation in terms of having screening and doing things to reduce their risk.
For women who are identified as being at risk of having a gynecological cancer due to their family history or due to the fact that someone else in the family has been tested positive for a genetic mutation, there is a high-risk clinic that is undertaken at the major treatment centres where women are advised appropriately about what screening they need to undertake in the way of ultrasounds and colonoscopies and so on, and also advised about what prophylactic surgery would be recommended. So that might be women who are beyond childbearing years and who might electively choose to have their ovaries removed to reduce their risk of ovarian cancer. Lots of decisions too that need to be made about when that testing happens, because there are implications for things like insurance and for superannuation. So it's not simply a matter of having a blood test and finding out whether you have a mutation or not. There are those practical and financial implications, as well as the burden that it imposes on someone who's living with the threat of their highly increased risk of developing a cancer at some point. Women are very worried, and it impacts on their decisions about childbearing, about careers, about financial planning, to think that they may at a quite young age develop a gynecological cancer. Genetic counselling starts off with meeting, often by phone initially, with a genetic counsellor who is able to get a fairly detailed family history and able to reassure people, many people, that the cluster of cancers they have in their family isn't indicative of a mutation, or conversely that the cluster of cancers they have suggests that there may be something that's worth following up. The issues around genetics for women with gynecological cancer are very complex. If there's already a very strong family history, what we might be seeing is a woman who's newly diagnosed with an ovarian cancer, for example, who has witnessed other members of her family be treated and often, unfortunately, in many cases die from breast and or ovarian cancer. I can recall a woman that we saw several years ago who was one of 5 daughters in a family, and she was the third of her sisters to be diagnosed and to eventually die from her ovarian cancer. So there's often a lot of distress. There's an appreciation of the devastating impact of the end stages of these diseases, right from the beginning. For other women where there isn't a strong family history and they may not have that direct personal experience of close family members dying, there are issues about the inherited aspect of it. So women who typically have already had their children and who then have the guilt that mothers carry so well about what they might have passed on to their children. Because if a woman is found to have, say, a BRCA mutation, then her children have a 50-50 risk of carrying that genetic mutation as well. So women often feel very guilty about what they may have imposed on, unknowingly of course, on their children.
Well, it was, I guess, at least some sort of reason why for me. I mean, otherwise, you would have no idea why these things happen. And if it's a genetic cause, well, then you can at least hang your hat on that.